Pelvic problems can affect actually a very wide population. It is conventionally believed that the people who suffer this problem are only women, especially women of a certain age, and that much is true. I mean, mostly is affecting that type of population, but actually everyone can be affected by pelvic floor problems and functional bowel problems regarding the sex, regarding the age. So someone with a very specialist practice like myself is quite common to see patients affected by pelvic floor problems of very young age, both male and female patients. And is one of those things that unfortunately is very often misrecognized or under-recognized also by colleagues, also by GP, and unfortunately for a very long time ignored. And these patients are left to suffer. So basically, I think it's very important to understand that these are conditions that are very common and can affect anyone, male, female, and regardless of the age. Symptoms related to pelvic floor problems cover a very wide range of symptoms. Basically, a lot of the organs involved with pelvic floor can generate symptoms. That means symptoms could be generated from a bowel point of view, from a gynecological point of view, and also from a urinary point of view. Myself, being a pelvic floor specialist from a colorectal point of view, I mostly focus on those symptoms caused or related to the bowel dysfunction. And these symptoms can be extremely common and once again can affect anyone, any age. And they include things like severe chronic constipation, difficulty going to the toilet, opening bowel, as well as struggling with bowel control, poor bowel control, leading to accidents of different kinds, but also problems such as chronic pelvic pain, prolapse of the bowel, and so on. So these are common conditions that to a certain extent can and these symptoms very often can happen together in patients suffering with pelvic floor problems. And some of these symptoms could be quite subtle and not always easily recognized. So it's also up to someone like me to be able to encourage patients to disclose those symptoms, asking specific and relevant questions to understand exactly what the underlying problem could possibly be. So it's a very, very general, very wide range of symptoms, including also less specific symptoms like abdominal pain, bloating, discomfort, nausea, as well as the symptoms I already mentioned earlier. Absolutely. Pelvic floor exercise play a very important role in the management of these patients. Pelvic floor exercise provided are done under the guidance of a correct specialist, and there are plenty of specialist nurses as well as physiotherapists who are specialized in this field who can advise and guide patients in the best possible way. They can play an important role in the management of these condition. Furthermore, these pelvic floor exercise or physiotherapy are very safe, can be continued in the long term, and is always a must in the management of patients with pelvic floor problems. The problem is to find the right specialist to guide you and do the right thing. The available options are very many, and they range from non-invasive management, conservative approach, to invasive or surgical approaches. It is always fundamental, first of all, to understand the underlying problem to that specific patient so that we can focus the treatment in the most and tailor the treatment in the most appropriate way. As a first-line treatment, we will always and strongly recommend a conservative approach. And sometimes you may be surprised how often things can significantly improve just following few simple advices. How to improve your diet, how to improve your lifestyle, maybe adding few medication, maybe depending on the problem, some laxatives, maybe something to slow down your bowel, or other minor symptomatic reliefs. So first line approach, always conservative, very often helpful to a lot of our patients. Only when those measures have failed, then we'd escalate the treatment to a little bit more invasive procedures. As part of the conservative approach, we would also consider, as we discussed earlier, pelvic floor physiotherapy, specialist nurse guided retraining of the bowel, and so on. There will be also, when we get to the point that these measures have failed, there are also specialist investigations that can be arranged to try to understand why the patient is not improved, what is the underlying problem, and understand whether there is a target for surgical intervention. Surgery, when performed in the right way, in the well-selected patient, in the experienced end, can make a massive difference. The problem is, because of the complexity of the underlying problem, we see too often in our practice the patients have been mismanaged, especially from a surgical point of view, making the underlying condition even more difficult to treat and finding a long-term solution less easy. So I think it's fundamental that these patients will be managed within an experienced, we would say, MDT. So what is an MDT? It's a multidisciplinary team. As I already mentioned earlier, pelvic floor covers three important areas. One, the one I'm involved with, is the bowel. Two, the gynae part. Three, the urology part. So bladder, uterus, vagina, and bowel, they all part of the pelvic floor. And very often, a patient suffering with one of these three compartments will be suffering with the other two compartments as well. And sometimes a joint approach, or at minimum, or at least a combined discussion and a combined management plan is key. And unless a patient is managed with this type of setting of an MDT, things are likely to not succeed or less likely to succeed. So it's important that this patient will be managed by an experienced specialist who is part of an experienced MDT. As part of this multidisciplinary team, it's also important to have the support of a specialist nurse, a physiotherapist, and a dedicated physiologist who is the person who will be doing the investigations to understand better the underlying problems. Pelvic floor problems are probably the most typical ones to affect patients' quality of life. As we already explained, there could be a very wide range of different symptoms related to pelvic floor problems. And depending on those symptoms, obviously, the impact on quality of life could be different. But the way they can often do that is by affecting the bowel function, patient struggling opening a bowel despite use of many laxatives over a prolonged period of time, having to spend time in the toilet trying with a very strenuous effort opening a bowel for a long time and still failing to do so, sometime even needing manual, invasive maneuver to try to help with that. On the other end of the spectrum, we may have patients who are actually struggling with bowel control, maybe have an accident, and this could be extremely embarrassing from a social point of view, from a personal point of view, from a sexual point of view. And also these are topics very difficult to disclose. Patients find embarrassed to bring this up, even when sitting in front of a specialist. You may be surprised how often patients come to me and for another problem, and I got the feeling there is something more to disclose, and I make them comfortable, and I ask in a very, very kind and polite way more specific questions, and the patient will disclose things that they didn't bring forward initially spontaneously. And once we initiate a conversation, there will be a very comfortable position, in a very comfortable position to carry on a conversation and bring more and more problems out. And you may understand that not being able to predict how your bowel is going to work, going out for dinner, meeting friends, or going on a trip may be impossible. And this is obviously a massive impact on your everyday life, your quality of life, and so on. Other symptoms like pelvic pain, abdominal pain, bloating can also interfere with your physical activity, exercise, and people are really invalidated by these symptoms. And as I said, it's not always easy to find a definitive solution to this problem, but very often this problem can be helped, often in a relatively simple way, in a non-invasive way, avoiding surgery. In extreme circumstances, surgery may be the only solution, but we can make a difference in the quality of life of these patients. And it's important that a patient is seen by specialists who understand those problems. And once again, I don't want to repeat myself too much, but patients come to me after I've seen 2, 3, or 4 different specialists who didn't even understand what the underlying problem was, and sometimes have offered surgery and performed surgery, which has nothing to do with the underlying problem. So I think these conditions are common, can affect quality of life significantly, and can be easily mismanaged. Yes, it is important that, as probably already mentioned, we always have an initial approach aimed to improve simple things such as lifestyle, diet, which can surprisingly make a massive difference to these symptoms. Patients who sometimes suffer with very severe constipation don't understand that changing the diet, improving the amount of fiber that they introduce in their diet, improving the amount of liquid that they have in their diet, can itself make a massive difference. Improving the lifestyle, introducing more exercise, and so on, can itself make a difference. Equally, patients struggle with bowel control, making them a little bit constipated, and then doing some specific pelvic exercise can reduce that. Talking about prevention rather than treatment, that is also important, and especially, but not only, in patients, young ladies who are who have had or have given childbirth, or likely will go ahead and give childbirth at some stage. And one thing that is often overlooked is that patients, the population mostly presenting with pelvic floor symptoms, will be women in a relatively advanced age. However, the actual underlying trauma that has led to this problem occurred many years early in life, when they gave childbirth 20, 30 years earlier. However, the symptoms get worse or come up only very late on in life, because the aging process is affecting the ability of those muscles to perform. So if we keep those muscles active, healthy, strong, may reduce and prevent the chance of developing these symptoms, and therefore could be used as prevention. Once again, healthy lifestyle, exercise, more specific pelvic exercise, core exercise, all healthy diet, all these things are important and can reduce the risk in the long term of suffering with more severe symptoms later on in life.